Bismillahirrahmanirrahim. Dear students, our lecture today is about the genetics. Genetics, as you know, is a recent science when we compare to other branch of medicines or surgery or gynae. It's the application of studying the genetics are critical for for all stages of the life and all manners of the diseases. And genetic studies have many applications in clinical practice. These include inherited component of common disease. For example, approach to diagnosis, genetic counseling, screening of individual at risk for genetic disease. We take example for example the thalassemia. Thalassemia, we want in the diagnosis to study the pedigree because it is autosomal recessive disease. We can expect the thalassemia major in children, about 25% of the children when the both parents are carriers. Also for the genetic counseling before the marriage, before getting child, we can give this risk for the parent, and also for the screening of individuals as a community at risk for the genetic diseases. Congenital malformation, also another application and malignancies. The genetic abnormalities responsible for many acute and chronic diseases that have onset at different stages of the life. Fetal, at birth, childhood, or even adulthood. Some genetic diseases might has an onset in adulthood. These genetic abnormalities might produce congenital malformation, for example, Down syndrome, metabolic disorder like the G6PD, and sex differentiation abnormalities, for example, Turner syndrome and Klinefelter, and also single order dysfunction, for example, VSD. When we study the genetic, we study at two levels. The cytogenetic, which means at the level of the chromosome, and molecular genetic. Molecular genetic means studying genetic at the level of the gene. So we have two types of the genetic studies, cytogenetic and molecular genetic. Cytogenetic at the level of the chromosome, which means that there is abnormality in the chromosome either in the number or in the structure, and the molecular level, which means that the defect in the genes followed Mendelian roles. I mean autosomal recessive, autosomal dominant, sex-linked recessive, sex-linked dominant. These are the genetic abnormalities at the gene level. So studying the genetics at the chromosome called cytogenetic, and the chromosomal abnormalities, whether numerical or structural, account for about 0.5% of all live birth and are a prevalent cause of mental retardation, congenital anomalies at birth, abortion, stillbirth, etc. So chromosomal abnormalities might be responsible for mental retardation, might be responsible for abortion, stillbirth, and various congenital anomalies at birth. The nuclei of the normal human cells, with the exception of the gametes, contain 46 chromosomes, which means 23 pairs. 22 pairs of them are autosomes, arranged according to their size, from the one which is the largest to the 22 which is the smallest, and 2 sex chromosome, which is either XX or XY according to the gender of the individual. The two members of the chromosome which are paired, or what they call the paired chromosome, called homologue chromosome. One homologue of each chromosome is maternal origin, source is the egg, and the second is paternal, the source is the sperm. The egg and the sperm each contain 23 chromosomes, which is the half number of the homolog, which is called haploid cell. During the formation of the zygote, they fuse into a cell with 46 chromosome called diploid. So the haploid is the cell contain half the total number, half the 46 is 23, while the cells that contain all the number called diploid. Abnormalities of the chromosome can be divided into two main. These are the abnormalities in the chromosome number, which is called the numerical chromosomal abnormalities. When the human cell has 23 chromosomes, I mean the ova or the sperm, it is in the haploid state. Haploid state we refer to as N. After conception, the cells, other than the reproductive one, has 46 chromosome called diploid state, which is 2N. So we refer for every 23 chromosome in the letter N. So N, 1N is the haploid state, 2N is the diploid state. Polyploidy, a cell contain any number other than the usual diploid number of the chromosome. Any number other than the 46 called polyploidy. Euploidy, this is the number exact multiple of the haploid. Exact number of the haploid, which means haploid is the 23 exact multiples, 46, 69, 92, etc. With every extra haploid, we add extra n. So 46 is 2n, 69 is the 3n, and 92 is 4n. Aneuploidy, this is deviation from the multiple of the haploid. Yani number of the chromosome is not the exact multiple of 23. For example, we have the Down syndrome. All of you are familiar with. Down syndrome is 47 chromosome, and this is not the multiple of the 23. بالحقيقة مو بس الداون سيندروم، يعني كل الترايسومي اللي عندنا الكومن هي 3 اللي هي الداون والبتا والإدوارد syndrome. So this means the presence of 3 rather than 2 particular chromosomes. This trisomy results from unequal division of a chromosome into daughter cell. Example اللي حكينا عليها داون والإدوارد والبتاو syndrome. So we now we come for the other type of the chromosomal abnormalities, which means the chromosomal structural chromosomal abnormalities. Abnormalities in the structure, there are different types. For example, deletion, here absence of the normal chromosome material. One of the chromosome has absence of the material. Could be either terminal or interstitial. Terminal at the end of the chromosome. Interstitial within the material of the chromosome. Example, 46XX DL1B36.3. This is how to read the chromosomal abnormality, which means 46 are the XX, she's girl. There is deletion in the chromosome number 1, deletion in the chromosome number 1. At the base 36.3 at the bond, from the bond, a bond of the 36.3. Example of this abnormality is here Cry-Dukas syndrome. Cry-Dukas syndrome here, deletion in the short arm of the chromosome number 5, characterized by unusual high pitch cry and dysmorphic feature. This is important how to read the chromosomal abnormality. This is 46 XX deletion in the chromosome number 1 at the bond 36.3. Duplication, extra copy of a chromosomal segment can be tandem or inverted. Tandem, the genetic material present in the original direction, or inverted in the opposite direction. For example, 22q long arm هذا طبعا 11, which is the cat eye syndrome characterized by the coloboma and anal or ear abnormalities. It is written as duplication. Inversion. A range section of a chromosome is inverted here. Ring chromosome, the genetic material is arranged in a circular form characterized by this ring chromosome characterized by mental retardation, mental and growth retardation. Translocation. Translocation means that there is some genetic material transfers from one chromosome to the other. This could be either balanced or unbalanced. Balance means that there is the translocation, the patient is completely normal, or individual patient, individual completely normal. Example عليها هو Down syndrome. Some mothers of the Down syndrome baby, she's young and has abnormal genetic study, abnormal chromosomes, which is in the form of the translocation. She is completely normal morphologically, completely normal. Or imbalance when there is loss of the or gain of the genetic material. Insertion. Breakage within a chromosome at 2 points and incorporated of the other piece of the chromosome, which means that there is one piece of the chromosome is breaked and incorporated into other chromosome. Sex chromosome, احنا اخذنا النيوميريكال، اخذنا الستركتورال. The third type هو sex chromosome abnormalities. These abnormalities include aneuploidy, which means that there is either absence of one X or extra X or extra Y, etc. These abnormalities include aneuploidy and mosaicism and are relatively common in general population. Include 45X, this is Turner syndrome, 47XXX or 47XXY, this is Klinefelter syndrome, 47XYY, which is called Superman. Mosaicism, other. Mosaicism بالحقيقة this is individual contain two cell line. One cell line is normal, the other cell line is abnormal. This is called mosaicism. In the presence of two or more different chromosome constitution in different cells of the same individual. Example, one of the individual Down syndrome بالحقيقة contain two cells. قسم من cells مالتها 46XX, which is mean female, and قسم normal, والother is 47XX plus 21 extra chromosome number 21, which is Down syndrome. So this is called mosaicism. The other mosaicism contains three cell line, not two line. This is two cell line, and I have 45X, which means that there is some cell contain deficiency of the X chromosome. 46XX, this is normal, and some cell contain extra copy of the X chromosome, 47XXX. Mosaicism. When we should suspect mosaicism, we should suspect it when there is a milder case of non-suspected clinical syndrome. For example, we have a Down syndrome, we suspect Down syndrome, or we diagnose Down syndrome, but it is very mild feature. The patient has very mild clinical manifestations or clinical picture of the Down syndrome. The other is if the patient skin show patchy or streaky hypo or hyperpigmentation. So any patient have patchy or streaky hypo or hyperpigmentation, we should suspect mosaicism. The prognosis is good when we compare to the original disease. For example, mosaicism, Down syndrome has a milder feature, have a better IQ than the usual 21 trisomy, which means the 47XX. The fifth type of the chromosomal abnormality is the uniparental disomy. Uniparental is when both copies of the chromosomes comes from the one parent. It has been documented for human chromosomes 7, 11, 15, and X. Also, it has been associated with certain syndrome or occur in certain syndrome, for example, Prader-Willi, Angelman, and Beckwith-Whitman syndrome. Clinically, it causes severe prenatal and postnatal growth retardation. The other type of the chromosomal abnormalities is the contagious gene syndrome. Here, it is resulted from deletion. Here, it results when a deletion causes the loss. Deletion اللي أخذناه ببداية المحاضرة cause a loss of the gene adjacent to each other in a chromosome. يعني we have deletion of the in one chromosome and the genes adjacent to each other is deleted, called contagious gene syndrome. Example, it can occur in Prader-Willi, Beckwith-Whitman, retinoblastoma, retardation, and Wilms tumor with aniridia, genitourinary abnormalities, mental retardation. هنا يفسر لنا why some syndrome contain abnormalities in different organ. For example, in Wilms tumor. Wilms tumor is the tumor of the kidney, but those patients have aniridia, which is abnormalities in the eye, and also have mental retardation. إذا واحد يسأل شنو علاقة المنتال retardation، شنو علاقة الانيريديا بالويلمز tumor، نقول إنه probably because of the contagious gene syndrome with deletion of adjacent genes. These adjacent genes are responsible, one for the Wilms tumor, one for the aniridia and mental retardation. Chromosomal fragility. Well known, there are certain factors cause abnormalities in the chromosome, either breakage or rearrangement. These factors include radiation, certain chemical, and viruses. However, some autosomal recessive syndromes with DNA repair defect are associated with greatly increased risk of the chromosomal aberration. Example, Bloom syndrome, Fanconi anemia, ataxia telangiectasia, or called Lewis-Parr syndrome. The last subject in the types of the chromosomal abnormalities is the chromosomal abnormalities in cancer. Many of the hematopoietic and solid tumors have chromosomal abnormalities. These chromosomal abnormalities could be either primary or secondary. The primary means that the presence of the chromosomal abnormality is necessary for the development of the tumor. For example, retinoblastoma, when there is deletion of the and the long arm of the chromosome number 13, or secondary. Secondary abnormalities appear in somatic cell de novo only after the cancer has developed. For example, والحقيقة كلش common هو الفيلادلفيا chromosome, which is the translocation between 9 and 21 or 34 and 11 in acute and chronic myeloid leukemia. The primary and secondary chromosomal abnormalities are specific for particular neoplasm and can be used for diagnosis or prognosis. Philadelphia chromosome is a good prognostic sign in chronic myelogenous leukemia and indicate a poor prognosis in acute lymphoblastic leukemia. These are the بالحقيقة احنا التايبس اوف ذا chromosomal اخذنا نظرة عامة عليها. هسه نجي نعطي examples of the numerical أكثر شيء numerical chromosomal abnormalities. We started with the Down syndrome. Down syndrome, this is occurring about 1 in 600 newborn. It is the commonest autosomal trisomy. حتى احنا بالبراكتس يعني نشوف ترايسومي 21 داون syndrome more common than the بتاو اللي هي ترايسومي 13 or Edward اللي هي ترايسومي 18. The risk is higher in old age mother, especially after the age of 35. Characteristically have mental retardation, the IQ between 20 and 80, but usually 45, 55. So it is severe mental retardation. Physical finding, a small brachiocephalic head. Characteristic faces include upward slanting of the palpebral fissure, apicanthtic fold, mid-face hypoplasia, small dysplastic pinna of the ear. 1/3 have congenital heart disease. The commonest were endocardial cushion defects or other septal defects. Some common AV canal, which means that there is presence of the ASD and VSD. 15% have abnormality of the GIT involving duodenum and esophageal atresia, generalized hypotonia, retarded sexual development. The male is always sterile, prolonged physiological jaundice, and this is in the neonatal period, prolonged physiological jaundice, polycythemia, transient leukemoid reaction in newborn, increased tendency to thyroid dysfunction, hearing loss, celiac disease, and atlantoaxial instability. This is important because sometimes we have a patient with Down syndrome at say the IQ is about 60. Suddenly he has deterioration of his IQ less than the 60. This is probably because of the thyroid dysfunction. Hearing loss is common. Celiac disease is common. Atlantoaxial instability. This is might lead to the sudden death. Sign increases, short broad hand, hypoplasia of the middle phalanx of the fifth finger called clinodactyly. Toes shows wide space between the first and second called sandal toes. An increased risk of congenital dislocation of the hip and hernia. This is the most important physical. بالحقيقة it is not all patients have all these, or not, not every patient with Down syndrome have all these manifestations. For example, patients with Down syndrome do not have congenital heart disease, or patients with Down syndrome have there is no thyroid dysfunction, or there is no atlantoaxial distress. اكو شيء لكن ما مذكور هو البريشفيلد سبوز. Freshfield spots are called Spickle's iris when there is dots in the iris also occur. Each of these have a percentage to occur in Down syndrome. For example, patient with مثل ما قلنا هنا يمكن موجودة 1/3 have congenital heart disease. بالنسبة للspeckled iris 4%. So not all patients. The most common manifestation من ذن يكون most common manifestation يمكن هو الhypotonia. All patients will have hypotonia. Also, there is an increased susceptibility to infection, especially recurrent chest infection. This is because of the congenital heart disease, hypotonia, feeding difficulty, defective neutrophil dysfunction. Also, there is an increased risk for leukemia, about up to 20 times when compared with the unaffected individual. Risk according to the maternal age, risk of having a child with Down syndrome. In 30 احنا قلنا general هو 1 over 600. In 30 years age 1000. 35 1 over n 1 in 365 365. 40 years 1%. 45 1 in 50. So as you see, when the maternal age is advanced, the risk of Down syndrome is increased. يعني يوصل إلى من 30 سنة عمرها 1 على 1000 45 إلى 1 إلى 50. So there is an increase with the risk for the advancing age. Risk of the recurrence. When the mother have a child with Down syndrome, she will ask you, can I get another child? So the risk in a chromosomal normal woman, less than 40 years, we give 1%. More than 40 years, increase more as a function of maternal age. If the mother has translocation, the risk is 10%. translocation يمكن حكينا عليها إذا انتبهتوا بالبداية قلنا المother is normal, has normal phenotype. Normal phenotype لكن abnormal karyotype means the shape of the mother, the feature of the mother is completely normal, but she has translocation usually between the 14 and the 9. So the risk is 10%. If the father has a translocation, the risk is 3 to 5%. Now we take some photos for the Down syndrome. Here the some of the feature about the slanting of the eye, the breast nasal bridge, mid face hypoplasia. The patients always have protruding tongue because of the small oral cavity. This is the karyotype. Karyotypes, I mean the chromosome, arranged according to the size from the largest one, chromosome number 1. بعدين size is get smaller until it reaches the 21, the smallest one. Each of these chromosome has 2 pairs. Chromosome number 1 has 2, chromosome 9, 11, 12 كلهم ما عدا 21 have 3 chromosome, which means that there is a trisomy 21. The patient is male because we have Y chromosome here. هنا نفس الشيء 21. تشوفونها كلها ارينجر، يعني حتى إذا ما ينطيكم الأرقام ممكن واحد يحسب النمبر اوف ذا كروموسوم، لأن تبدون من الجهة اليسرى العليا وتحسبون 1 2 3 لحد ما تصلون، يعني ممكن إنه ما ينطيك هاي الأرقام بس تحسب وتلقى إنه 21. تشوفون هذا شوي always open the mouth oral هنا clear. This is because of the small oral cavity, هذا typical about the slanting of the eyes. Simon creases. Simon creases is not pathognomic for the Down syndrome. This is the wide gap between the first and second toe called the sandal toe, and this line called Sydney line. هنا hypotonia، هنا أيضا frog like posture hypotonia. This is all demonstrate the hypotonia. Okay, this is one of my patients في الحقيقة اللي هو الكلينودactyly. Clinodactyly means hypoplasia of the middle phalanx. Hypoplasia of the middle phalanx lead to the inward curving of the little finger. The eyes طبعا they are more liable for the conjunctivitis, blepharitis, etc. هنا طبعا cyanosis clubbing because of the congenital heart disease. This is the speckled iris, what we call the brush field disposed. This is occurring about 4% of the patient with Down syndrome, and we can see this fold. This fold is the epicanthic fold. Good. This is one of my patients. بالمناسبة they are lovely. They are social. The family بالحقيقة كلش يحبون الأطفال والداون syndrome لأنهم مو مؤذيين، مو مثل other mental retardation. Now we come for the Edwards syndrome. Edwards syndrome is the trisomy 18. The incidence in 1/4,000 live birth. You see it is much rarer than the Down syndrome. Male to female ratio is 1 to 3, so it is more common in female. Physical finding include pre and postnatal growth retardation, hypertonia. الوحيد من الترايسومي اللي عندهم هايبرتونيا. البتاو عندها هايبوتونيا، الداون سيندروم عندها هايبوتونيا، لكن الادوارد عندهم هايبرتونيا. There is also closed fist and with index finger overlapping the third digit and the fifth digit overlapping the fourth. narrow hip with limited abduction. هسه نشوف صور شو تبين هذه abnormalities in the hands. Short sternum, rocker bottom feet, microcephaly, prominent occiput, cardiac and renal abnormalities, commonly here horseshoe kidney, mental retardation. 95% of the cases lethal in the first year. Again, karyotypes. This is the chromosome number 1. This is the largest. إذا نجي نحسب 2 3 4 5 لحد نوصل إلى 18. 18 شفنا 3 chromosome rather than 2. So this is the trisomy 18. Here, this is hypertonia. This is the clenched hands with index finger overlapping the middle and the little overlapping the fourth finger. A prominent occiput, locet ear. This is clear. The hands. بالحقيقة overlapping not only the hand, also on the foot. You can see, you can overlapping. Myelomeningocele is more common in Edwards syndrome. Myelomeningocele, which is type of the spinal dystrophism or called neural tube defects. Rocker bottom feet. Rocker bottom feet مثل كرسي الهزاز. Rocker bottom feet. Short sternum. Now we come for the Patau. Patau syndrome trisomy 13. The incidence is much rarer than the other. 1 over 12,000. 60% female. The mean maternal age is increased. Physical findings include pre and postnatal growth retardation. Sometimes might have normal weight بالحقيقة. Unlike that of the Edward. الإدوارد عادة يكون small for gestation. CNS malformation, eye malformation, cleft lip and palate, scalp defect, aplasia cutis, polydactyly. So any patient with a cleft lip and palate, you have to examine the hands for the hand and foot for the polydactyly and syndactyly. We can diagnose Patau syndrome just by these two findings. Congenital heart disease, usual VSD, death usually in the first year or second year, commonly as a result of heart failure or infection. This is the chromosome number 1, the largest. 2 3 4 نوصل إلى 12 13. شفتوا 13 is the 3 chromosome. So this is the trisomy 13. Cleft lip and palate, very clear. Cleft lip and palate with polydactyly. This combination always you should raise the possibility of the Patau syndrome. Polydactyly. هنا طبعا احنا نسميها holobronchivaly, both cleft lip and palate. Plasia cutis or cutis aplasia. This is absence of the skin of the scalp. This is also characteristic for the Patau syndrome. Open neurotube again might occur. Open neurotube defect. Polydactyly. Turner syndrome. Turner syndrome احنا لحد الان اخذنا هي الكروموسومال abnormalities of the autosomes. شو 21 18 13 كلهم ذني autosome. لكن sex chromosome عندنا Turner syndrome اللي هي absence of the one of the X chromosome. It is occurring about 1 over 10,000. It is estimated that 95% of the conceptors of the pregnancies, with monosomy X are miscarried, and only 5%. يعني اللي كل الكيسات اللي نشوفها بالبراكتس بالتيرنر syndrome, this is represent 5%. and 95% will be aborted. So one of the causes of the abortion هو Turner syndrome. Physical findings include webbed neck, edema of the hand and feet, characteristic triangular faces, coarctation of the aorta is very important, chest with widely set nipple and cubitus valgus, hyperconvex fingernail, low posterior hairline, short stature, streak ovary. This is also important because sometimes diagnosed as the adolescent when the girl does not have menses, and the secondary sex character. Absence of the secondary sex character. Complication related primarily to the coarctation of the aorta when present. Rarely, this genetic gonad may become neoplastic gonadoblastoma. الكومن برزنتيشن اللي شفناها بالبراكتس هو يجي البيشنتس with edema of the hand and feet يسموها pedal edema. طبعا هواية منهم يصير عندهم heart failure because of the coarctation of the aorta. Again, the karyotype, you can see the not two pair كلهن ما عندي مشكلة بالأوتوسوم 22 21 22 ما عندي مشكلة. إذا وصل للإكس كروموسوم أكو بس كروموسوم واحد. إذا this is the Turner. طبعا بالميل نفس الفيتشر نسميها نونان syndrome. Web necked, you can see the webbing of the neck, widely carrying angle of the elbow, edema of the foot and the hand, low hairline أيضا هنا webbing of the neck, very important webbing of the neck. edema, widely spaced nipple يسمونه shield chest. This is the webbing of the neck. Now we come for the Klinefelter syndrome. Klinefelter syndrome, there is incidence is 1/1000 newborn, about 1% among mental retarded and 3% among our male seen in the infertility clinic. I mean, the general incidence is 1/1000. لكن إذا رحنا للmental hospital أو group of the patients with mental retardation نشوف الانسيدنس 1%, which means this is a good cause for the mental retardation. وأيضا إذا رحنا للinfertility clinic نشوف إنه 3% of them is Klinefelter, which means this is also another cause for the infertility. So keep in mind, Klinefelter syndrome have mental retardation, have infertility. Maternal age at birth is often advancing, so it is occurring in older maternal age. It is rarely cause abortion. مو مثل Turner syndrome. Turner syndrome عندهم نقص بال one of the chromosome, extra chromosome. Diagnosis rarely before puberty. لأنه ما عنده ذيك الفيتشر اللي ممكن الفيتشر عادة تطلع بالبيوبرتي. Pre-puberty is normal phenotypic. Physical findings include microorchidism associated with normal external genitalium. Testicle is small. أيضا عندهم azoospermia, sterility and gynecomastia. That is why it is more common in fertility clinic. Gynecomastia also occur. Normal to borderline IQ. اللي شفناها بالحقيقة most of them هم low IQ. Diminished facial hair. Lack of libido and potency. Tall, inocoid pelt, they are tall. عندهم طبعا radio ulnar synostosis, يعني اكو فد abnormality بالبون of the radius and the ulnar. Those XXY هنا راح يصير اكسترا اكس يعني 3x مو 2xy، واللي هنا يصير 3. المنتال ريتارديشن السيفير على المانيفستيشن راح يكون مور سيفير كل ما يكون اكسترا اكس كروموزوم از بريزنت. هنا اللي حكينا عليه راديو ulnar synostosis may be present plus abnormality of the external genitalia and the cryptorchidism. You can see they are tall. Gynecomastia. told